Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of focus are on weight management, preventative medicine, and holistic health. Today we have with us Dr. Reza Eftehar. Thank you for being here with us today, Dr. Eftehar.
Thank you for having me.
Great. And Dr. Eftehar is the clinical director at the Metropolitan Headache and Spine Center in Alexandria, Virginia. He's also a clinical faculty member of University of Maryland's School of Medicine. And he is a licensed chiropractor through the state of Maryland and the Virginia Board of Medicine. His practice focuses on treating patients with migraines, TMJ disorder, spine-related injuries, and arthritis. So thank you again for being here with us today, Dr. Eftehar.
Thank you so much.
Great. Today we're going to be discussing scoliosis and the effects, early detection, and prevention of scoliosis in children. So tell us, Dr. Eftehar, what exactly causes scoliosis?
Well, scoliosis, for a lot of people, it could be from adolescence. And today we're going to mainly focus on adolescent, but I'll talk to you about people that overall, as they work with certain postures, and that'd be maybe for another segment, they their spines start to become scoliotic and become either C-shape or S-shape curvature.
So this is something that actually develops as a child grows?
Right, so it could develop as a child grows, or it could develop as people work on the computers, different postures, bad ergonomics, and so on. And usually especially the ones that as child grows, it could be where they're born with a certain genetic defect where it causes scoliosis. It could also be overall, right now kids are, in front of computers all the time, iPads and iPhones, and they're always scrunched up, holding on to the phones, looking down all the time. Over time, they start to create a lot of headaches and scoliosis and spine curvature that changes over time.
Okay, so if it's a genetic disorder that they may be born with, is that something that if they're having those, sitting in front of the computer, is that going to make it worse? That's going to make it show up, or will it always appear?
Right, so great question. So number one is that obviously if they already have a predisposition to have scoliosis, they have a higher chance of making it worse if they already in bad postures and they're working on computers in a non-ergonomic fashion. Okay. So basically we want to make that least as possible, less chance of making it even worse, the case they're having. Now, depending on the scenario and the degree of the curvature, we can also correct that and we can relieve some of the curvature. But if it's really bad, obviously surgery is definitely an option for that kind of case. Okay,
but how is it initially diagnosed? What sort of symptoms can someone find in their child or themselves?
Well, one of the most obvious one, Alejandra, would be the fact that you can see it on your child's spine. If his or her shirt is off, you can kind of see the spine's kind of crooked. You may see him or her leaning a certain way that maybe you'd be wondering, why is he or she leaning to the right a little bit? His shoulders, you may be looking at him, you'll notice that one of his shoulders just slanted a little bit. And you may be looking further into that and maybe he or she has scoliosis, or maybe there's some other problem that needs to be addressed with the shoulders, so you can address it that way. There's also DNA tests. There's actually a swab. You can swab anybody and figure out if they're gonna have scoliosis, if they already have it, and if they're predisposition to it. So that's some ways you can find out if your child has scoliosis.
Okay. Is it something that you would recommend for someone maybe who's looking to have children and have that DNA test run prior to that?
Well, I wouldn't really worry about that. If you want a child, usually doesn't matter. It's not like you can do anything about it while they're a baby, really, necessarily. There are some chiropractors and maybe even some physical therapists that work on children. So they're sort of pediatric chiropractors that work on children. They may be able to help with certain cases with very, very light manipulation to the spine, almost very subtle. And so that may help if they're a baby, usually we won't really worry about it until they're more, past about 5, 6 years old to see what their actual spine is going to really look like.
Okay, so if they're having those, if you notice that their spine is a little bit off or their shoulders are off a little bit, is that something that has to be treated? Should they go and see a chiropractor?
Right, so I would say that you definitely want to treat that, because what happens is in the beginning it may be very subtle, but over time, gradually, a lot of times becomes worse.
Okay.
And if it becomes worse, then you have a higher chance of having headaches and neck pains and low back pain, and children might be having a problem running or walking. Their hips might go a little crooked, their shoulders are off, and it just seems to a lot of times get worse.
Okay.
And it causes a lot of problems with child education, because obviously if they're in pain, they're less likely to learn, they're less likely to enjoy their life, and you don't want to have that. So it's always good to take care of that while they're young, while they're growing, while they could change. Now, depending on how bad the scoliosis is, sometimes you do need bracing of the spine. Sometimes you may need surgery, because if the scoliosis is really bad, it could hinder on the heart and the lungs. It could stop them from taking deep breaths.
Oh, wow.
It could cause asthma or heart issues. So those are factors that gets really significant, if it's really bad.
And so you mentioned that there's braces and then also surgery. What other, are those the only type of treatments?
Well, those would be, really, really bad cases. At first you want to bring it to a professional, maybe a chiropractor that has experience with scoliosis, which a lot of us do have. We take extensive classes in musculoskeletal disorders, and we can kind of, through x-rays, we would take an x-ray or send for an x-ray and figure out what degree of scoliosis it is, and whether it's something that should be addressed in a chiropractor's office or should be addressed, orthopedic surgeon, neurosurgeon, depending on the situation.
Okay, so there's different levels of treatment that can happen.
Right, exactly. So, but first, you don't want to take it right to an orthopedic surgeon right away, unless you notice that it's a gross, posture. But you want to take it to probably a chiropractor first to get it checked out. And then from there, the chiropractor will advise, after taking an x-ray, will advise how bad the degree is. And based on the degree of the curvature, he or she can recommend, the doctor can recommend if you should see for bracing or orthopedic surgeon.
Okay. And is there a specific age that you would target to start that treatment?
So, I would say as young as possible, really.
Okay.
It's probably better to start about 5, 6 years old.
Okay.
If you notice they're kind of off. If you notice, maybe sometimes I've seen children as young as 2 years old when, and they're walking and one of their foot is off a little bit, right? Okay. So, and they're kind of wobbling, and over time that may cause scoliosis, Okay. So, I mean, anytime there's a mechanical dysfunction, everything's attached, right? So the spine, neck pain could cause low back pain over time. Low back pain could cause neck pain over time. It's a chain reaction. Okay. So if your foot is off, your knee can get off, be over time it can go inwards, can mechanical dysfunction in the knee, then hip dysfunction, go into low back, and all the way up the chain.
So it's not just necessarily looking for that curvature of the spine. It's also just checking to see for your children to see if there's any other type of misalignment.
Right. Absolutely, absolutely. So you want to make sure that their knees aren't in, their hips aren't forward. One of their foot, maybe if they stand still, one foot straight, one foot that's this, crooked this way, and then you might want to see like, why is that? Or maybe the other way around. So you want, everything sort of has to be sort of even. Right. If the shoulders are this way, why is that? Is there a problem in the shoulder here? Is it because of the shoulder? Is it because of the neck? Or is it because of the spine? It could be a different variety of reasons for that kind of thing.
Okay, and of course that can help prevent, you mentioned, scoliosis if it's not already something that's genetic.
Right, absolutely,
okay.
Yeah.
That's great.
Yeah, absolutely. So if it's not genetic, then a lot of times scoliosis is, number one, we have to stop the progression of scoliosis, right? Number two, we can always treat it to a certain degree. Now, depending on how bad it is, it could become almost normal or normal to significantly better. And at the very least, we can stop the progression, because if it gets anywhere, at least you know, maybe at that point they can live with it, but if it gets any worse, that's not good. Again, it could put pressure on the heart and the lungs and cause different more aches and pains. Yeah,
Okay.
throughout time.
So if there's those other concerns, you know, on the heart and lungs for a child, at least would they be okay to, you know, if they are or aren't getting treatment, can they still exercise? Or, you know, even teenagers, are they able to exercise with scoliosis?
Yeah, absolutely. Well, I mean, they can't exercise with scoliosis, depending on how bad the scoliosis is. You know, it would possibly cause more injury depending on the exercise. Now, if they're lifting weights and they have a C-shaped curvature or S-shaped curvature on the spine, they're lifting weights the wrong way, they're going to put pressure, they may injure themselves even more.
Right.
So you definitely want to know what type of exercise. Again, probably a professional, a doctor, doctor of chiropractic would be probably the best avenue to figure out what's the best exercise rehab. Should they be doing that exercise? And then there's a muscle imbalance involved as well. So it's not all skeletal system. There's a musculature. If there's a C-shaped spine, for example, you know, forward, you know, head forward carriage, and your back is kind of in a C shape, now that causes deformities. So some of the muscles are weak. Some of the muscles are super tight. So we want to facilitate some of the muscles and inhibit some of the muscles that are too tight. You want to inhibit those. And the muscles that are not working, they're not pulling their own weight. You want to facilitate those so they start working properly and they start to pull their own weight, because the other muscles get, you know, they have to take a brunt of things because some of the muscles aren't doing their job.
So some exercise could actually help.
Right, rehab,
that.
exercise, definitely. But, you know, just lifting weights the wrong way is not the right exercise. You have to make sure, you know, first you got to get diagnosed. Then you got to figure out what is the problem, which muscles are inhibited, they're not working, which muscles are too tight, and they need to be fixed.
Okay, and it's interesting you were mentioning also the C curvature. I think a lot of us probably think of just the misalignment. Maybe that's the S curvature, but there also is, if you kind of are bent over, that's also a sign of scoliosis.
Yeah. Okay. So there's two types of scoliosis. There's a C shape, which is hunching forward. There's the S shape where the spine, as you're standing still, part of it go this way, parts of it go this way, and like a snake kind of.
Gotcha.
Scenario,
Okay. And so now, going back just to the treatments, if the doctor does recommend surgery, what is the best, surgery or procedure that you recommend for that?
So I would refer to the professional that actually does that. I wouldn't make remarks specifically for orthopedic surgery. I think that's a different arena that needs to be consulted with a good orthopedic surgeon. And there's a lot of different new technologies out right now that some orthopedic surgeon may know more about, may not know more about, and you definitely want to consult with someone that is pretty updated. Obviously, you know, you can look at their background, look at their education, look at reviews. You can ask I know a lot of orthopedic surgeons, I know a lot of neurosurgeons, so I can definitely give good recommendation of where to go and who I think, you know, few doctors that I think they should be spoken with.
Which part to follow, right? So of course the first part is to make that appointment and see you and see what type of care can be done if needed. So thank you for being here with us today, Dr. Eftekhar.
Thanks for having me.
It's been a great program, and thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and Virginia Medical Updates is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine to complement their expertise in medical care. Their areas of focus are in weight management, preventative medicine, and holistic health. Thank you again for joining us.